Any shortness of breath?
Despite Dr. John Karangi being in Virginia, on Wednesday he spoke with a woman living in Louisiana face-to-face about her health.
All the symptoms that we're looking for to see, what could this patient have and how can we manage them, we can do all that remotely.
CareClicks, one of the providers now offering telehealth services, allowing people to speak to doctors without needing to go to a clinic or hospital.
This can be through desktops, laptops, tablets, mobile devices.
Dr. Karangi saying CareClicks has averaged a dozen calls an hour during the coronavirus outbreak from healthcare providers wanting to join the service. With people told to social distance and self-quarantine, Dr. Karangi says telehealth can now play a crucial role in the fight to stop the spread of the disease.
There are patients who are in those doctor's offices, who are in those hospitals that have other issues. And we don't want to have other pathogens kind of mix into what's going on with that specific patient.
With wait times of just 10 to 15 minutes after users book an appointment, Karangi says more and more medical providers want to offer similar resources.
Staff organizes the response out of their offices here in Alexandria, and as it stands right now, 2,500 doctors stand ready to help out with services.
Other medical groups reporting similar spikes. Health provider Kaiser Permanente reporting back-to-back record-breaking days last week for its 7-year-old telehealth service, with the amount of video visits double the normal daily amount.
I think what we'll see probably after this and as things grow, that people see the huge value add with it.
Telehealth providing valuable support during a crucial time and possibly playing an even bigger role in the years to come. Tom Dempsey, WUSA 9.